Okay, let's look at stroke. Remember, guys, I told you about the HAS formula. These are the most common areas that get tested in the GPhC exam. And one of these is stroke. So what are the common areas that get tested? Number one, you need to understand acute stroke management. Then you have TIA management, stroke symptoms, and CHA-2DS2-VASc. Please learn these as these get tested all the time. And once you've gone through this video, make sure you practice the questions on the website and the quizzes as well to really strengthen that information. So let's go into the first thing we need to learn when it comes to this chapter is the symptoms. So you all know about your FAST test. You need to know this. It gets tested in the GPhC exam. So F for face droops, arms, that's what A is for, you can't raise the arms, speech is slurred, and T means it's time to call 999. Right, so learn your symptoms and that's fine. You don't need to know more. These are the most important symptoms for you to learn. Now, the next thing I want to look at is the general drug management principle. I say principle is what's going to help you to guide you whenever you think of stroke. Think about stroke as it's a very, very important, urgent condition. So ASAP, it has to be dealt with as soon as possible. Remember ASAP. ASAP are the general drugs that we use in stroke. A for antiplatelets, S for statins, and anticoagulants. Anticoagulants are only used when patients got DVT or PE or AF. But majority of the time is mainly antiplatelets, statins, and then PPIs. So what do we need to learn? The first thing we need to learn is how do we manage a TIA, trans-ischemic stroke? How do we manage this? First thing is, and this was an update, you have patients that have high risk of bleeding and low risk of bleeding. If a patient has a low risk of bleeding, you can give them or you should give them 2 antiplatelets. If they have a very high risk of bleeding, only 1 antiplatelet. The main antiplatelet we give is aspirin 300, and that's just given 1 dose immediately. Okay, so aspirin 300 milligrams, 1 dose is given immediately, and then after that we're going to reduce it and start giving them 75 milligrams. And if a patient cannot take aspirin, we could give them clopidogrel. In terms of patients that have a low risk of bleeding, we give them 2, so that's aspirin and clopidogrel. With clopidogrel, this is so important, we will give clopidogrel for 21 days with aspirin. But if you give them ticagrelor, which is another antiplatelet you can give, with ticagrelor, it's 30 days. So that's important for you to know. Clopidogrel is 21 days with aspirin, whilst ticagrelor is 30 days with aspirin. Now, you know about TIA. You know how to manage TIA. This is the initial management. We're going to look at long-term management later because that's common with acute as well. So let's look at acute stroke. Now, acute stroke gets tested quite a lot. So what do we need to know? We need to know about step 1. The first thing is, has the stroke happened within 4.5 hours? If the answer is yes, the patient's had a stroke within 4.5 hours, very important number or time for you to learn as well. If that's the case, then you could give them a alteplase or tenecteplase. Right, these are thrombolytic drugs. You could give alteplase or tenecteplase as long as it's within 4.5 hours. The second step is you give them this antithrombic or thrombolytic agents. You give them for 24 hours. Once they've had alteplase or tenecteplase, you can then start them on an antiplatelet, which again is usually aspirin, for 2 weeks. And then after that, we move on to long-term management, which is normally clopidogrel, a statin, and blood pressure tablets. Normally we will normally avoid beta blockers. So again, very, very important for you to learn these. Please learn this. I'm trying to make it so easy so that in your exam, it's so straightforward. Alteplase, tenecteplase, within 4.5 hours, give it for 24 hours, then you give them an antiplatelet for 2 weeks, and then long term is going to be clopidogrel, statin, blood pressure tablets. Always avoid beta blockers. If this was more than 45 hours, so the patient had a stroke and it was they literally came to hospital, say 5 hours later after the stroke, then we go straight into step 2 and then step 3. Okay, we don't give them alteplase. So yes, so this is literally a summary of how to deal with your acute stroke. And in terms of the long-term management, that's the same long-term management for both TIAs and acute stroke. Okay, so long-term management or treatment is normally with clopidogrel. It's normally with clopidogrel 75 milligrams. If the patient cannot take clopidogrel, then we give them aspirin 75. We give them a PPI, especially those that have a high risk of bleeding. We give them a high intensity statins. So high intensity statins, these are all in your lecture notes. They're all on the notes that you have on the website. But an example of a high intensity statin is a atorvastatin 20, like we mentioned. So you give them a high intensity statin, you give them the blood pressure medications, but one that you have to avoid is a beta blocker, as it could exacerbate symptoms of stroke. So you avoid beta blockers. Very, very important that you know this. So the next area that gets tested a lot under stroke is the use of your CHA2DS2-VASc tool. So CHA2DS2-VASc definition is used as a clinical score which is used to assess the risk of stroke in patients with atrial fibrillation. It's so important that you know that the patients have to have AF. So patients with atrial fibrillation, so what sort of areas get tested in your exam? What comes up quite a lot? The first thing is you need to know the definition, which we just looked at, but you need to know what every single letter stands for, and you need to know the score of each and every parameter in your CHA2DS2-VASc tool. So here's what we have for you. So this table is paramount for you to learn this. You must learn this table, and you must learn the points or the scores. So C here is for congestive heart failure. H is for hypertension. A is for age and the two ages. There's the age which is 75 years or older, which normally has 2 points. And then there's another age, which is this one over here, which is 65 to 74, which has a lower, just 1 point. So learn all of these parameters, what everything stands for, the vascular disease. You need to also learn about those that have 2 points. They're just two things that normally carry 2 points. And they love to test you on calculations. So you have to work out the points and you have to interpret the results. That's why it's important that you know those that carry 2 points. If a patient's had a TIA, they had a previous history of stroke, they have some sort of DVT, that's 2 points. If a patient is older, if a patient is 75 years or older, then that's 2 points. Everything else is 1 point. Another thing that you have on here is the interpretation. The GPhC requires you, and the exam you get tested to make sure that you know how to interpret CHA2DS2-VASc scores. So if a patient has a score of 0, and that's a male, or a female with a score of 1, then they have a very low risk. They have a very low risk of getting a stroke. So you wouldn't need to give them any anticoagulant. If a male patient has a risk, a score of 1 and above, a female or male have anything from 2 and above, that's when we normally give them anticoagulants, because they have a higher risk of getting a blood clot. So moderate, if it's 1 for a male, you give them oral anticoagulants. If it's 2 for a female or male, anything from 2 and above, that's high risk, and so you will give them oral anticoagulants as well. So this table is quite key. It's simple. I put that together because this is what gets tested in your exam. So let's try an exam question. Let's show you what comes up in your exam. So an example is calculating your CHA2DS2-VASc score. So a patient is 78 years old, so a 78-year-old woman with a history of hypertension, type 2 diabetes, and heart failure with reduced ejection fraction, is diagnosed with new onset atrial fibrillation. Now they're asking you, what is the CHA2DS2-VASc score and what is the most appropriate management? So let's work this out together. What is the score? We can see clearly that this patient is 78 years old, so that's already 2. Plus it's a woman, and this is what many people forget, she's female, so we're going to have 1 point, so that's 2 plus 1. Patient's got hypertension, that's another point, so that's 1. Patient also has diabetes, which is another, which is 1. And then we can see over here that the patient has heart failure as well. So if they have heart failure, that's 1 as well. So what does this give us? This gives us a total of 6. So the correct answer to this question, which again, the GPhC question has come up, is 6. Your correct answer is 6. That's the score. And a CHA2DS2-VASc score of 6, they may test you, asking you what you have to do. Because it's a high score of 6, you have to give that patient an anticoagulant, which in most cases is normally a DOAC. So thank you. Hope you enjoyed this. Make sure that you go onto the website, you go through this note. I have all the slides on there. We have more on there. We have quizzes. Just unstroke and practice this, and you'll do well in your exam.